So now just introducing the speaker we have today. So the title of his presentation is Introducing the Haven Uro-Oncology Program. And we have with us today Alan Birch. Alan Birch is the Associate Director of Provider Solutions Oncology at Centrix Health. He's also the founder of Drug Access Canada. You can see more information on their website drugaccess.ca. It provides resources for patients and healthcare providers. Alan started as an oncology drug access navigator at North York General Hospital in Toronto, where he worked in the Cancer Center for 8 years. At Centrix, Alan created the Prostate Cancer Patient Support Program called Haven. And without further ado, I will stop sharing my screen and let Alan continue with the presentation.
Thanks, Maya.
Yep, that's perfect.
There we go. Perfect. Okay. So thank you everyone for joining this evening or this afternoon, depending on where you are, to learn about our Haven Urology Program. Oops. So first, I just want to thank the Advanced Prostate Cancer Support Group for having me and my colleague have this time with you to talk about our prostate cancer support group called Haven. And hopefully it's something that will be able to help either you or others who are part of this group or others across Canada who have prostate cancer. So first we want to start some introductions. So as mentioned, my name is Alan Birch. I'm part of the Haven team here at Centrix. So you heard a little bit about my history. I've worked in oncology now for about 12 years at different hospitals, supporting lots of patients with prostate cancer over the years. Just recently, 3 years ago, joined Centrix to create the Haven program, which supports prostate cancer as well as many other types of cancer. But prostate cancer is the number one that we support currently within the program. And my colleague, Brenda, who's in the middle there, do you want to introduce yourself?
Absolutely. Thanks, Alan, for that. And thank you for the Prostate Cancer Foundation for giving us an opportunity to touch base with all the wonderful people like yourself who have questions about the prostate cancer support that our team can provide. I'm an oncology pharmacist by training, worked for 6 years in oncology in hospital. And last year, Alan asked if I could join the team at Haven. And our goal is to partner with patients living with prostate cancer to provide multiple different avenues of support, clinical information. I'm a pharmacist, so questions you have about medications, I'm always more than happy to have a conversation. And as Alan will go over, there's some other ways that we can support you as you go on your journey with cancer.
Thanks, Brenda. And on the right is our other colleague. Her name is Stephanie. She's not with us tonight, but she is a drug access navigator. She comes to the Haven program from Princess Margaret Hospital in Toronto. So her role is really to get drugs approved as quickly as possible, whether it be by the government or by a private insurer. Her job is to work out all of the different options to get drugs paid for, to support patients with accessing medication. So one of the questions we get asked a lot is, what is Centrix? Who are you guys? So I'll spend just a little bit of time just to give an overview of our company. So Centrix is basically, it's a pharmacy. It's a group of pharmacies. We have locations all across Canada. We're not a very old company, so that might be why, if you haven't heard of us before, that might be why. So we were only founded in 2017, but we have 500 employees now across Canada. And even though we've only been around for a few years, we do support 125,000 patients across Canada. Not all of them are cancer patients. We support patients with a wide variety of different diseases, but it is at 125,000. And we also focus on integration between our patient support programs and our pharmacies. So that's what we'll be talking about with Haven. So you can see here an example of one of our Centrix pharmacies. This is our location in Moncton, New Brunswick. So this is where you'd be able to go pick up medication. That's our counseling room to speak to any of our staff pharmacists in our pharmacies. But we do have locations in Vancouver, Calgary, all across Canada. So when it comes to oncology, Centrex does operate multiple programs, often through drug manufacturers. And across all of our programs, we have 30 different medications. We have thousands of cancer patients that we support across all of Canada and across multiple cancers. We do focus on trying to provide quality care. So this is why we have people like Brenda on our team who comes from hospital cancer centers. Myself as well, I come to Centrex and our pharmacy group from a hospital cancer center. We know oncology quite well. We've supported many prostate cancer patients over the years. We also try to make sure that when patients are starting on treatment, it's done as safely and smoothly as possible. So we use a lot of resources at our program that align with what your primary treatment team in the hospital uses. So they use things like co-stars for side effect management. This is a series of questions that nurses ask patients to see how they're doing on their new medication. So you might have noticed a lot of the same questions being asked by the nurses. It's because they're following these standardized processes. And same with the MOAT tool. So this is used by pharmacists when they're counseling on new cancer drugs. So we use a lot of the same processes and standards that are used in hospital as part of our oncology program. And same with the training that our staff receive. We have the same D'Souza training requirement that nurses in cancer centers in hospital are expected to obtain certification for. And same with our drug reimbursement specialists. So Stephanie comes from a hospital cancer center. Our whole team has worked in hospital. And then the other part is being really customized. And we know that every patient is very individual. Each province is very different in how they treat cancer. So we want to make sure that although we're helping patients across Canada, that we're able to meet the needs and expectations the way your hospital operates, the way your urologist or medical oncologist treats cancer, and also meeting your needs. So depending on how you like to be communicated with, or when you want to be communicated with, or when you want to talk to Brenda, we try to make sure that we customize as much as possible to make using our program really easy. So a little bit about our Uro-Oncology program. So Haven is a patient support program. If you're on any of the take-home cancer drugs used for prostate cancer, you might be familiar with some of the different programs that are used to support co-pays or providing financial assistance or injection support for medications used for prostate cancer. So the Haven program is a way of putting all of those medications together into just a single program. So you can see here all the different drugs that we're able to provide from our pharmacy. You might be on some of these medications. These are all drugs that are either done as oral therapies or injectables. So they're either pills or something that's injected maybe every month or every few months. The point of having all of these drugs combined is it makes it easier for your treatment team, so your medical oncologist or your uro-oncologist or your radiation oncologist, to be able to get multiple drugs supported in one go. So if you're on several of these drugs at the same time, your treatment team might have to fill out paperwork for one drug, and then the other drug fill out a whole other set of paperwork. And it can take a lot of time for the treating team. So your doctor has to spend a lot of time on forms and paperwork. What we can do is the doctor can just say, I want these 2 drugs or these 3 drugs for my patient, and then send the form to us. And then our team can take care of everything else. So we really want to make sure that using our program is not only easy for patients, but we want to free up the medical oncologists, the uro-oncologists, so they're not spending hours of their week filling out forms and paperwork. We can take a lot of that off of their plate so that they can see you, spend more time with patients, and do more actual treatments as opposed to a lot of the paperwork, which they don't really want to spend time on. The other benefit for having all of these drugs combined into one location is, especially with prostate cancer, often you're not just on a single drug. So I have some examples here. Drugs like abiraterone or Zytiga, you might be on that medication. It's also taken with the steroid drug prednisone, or also sometimes dexamethasone. And it's sometimes given just as those two drugs, but it's also sometimes given with an injection like Zoladex or Lupron. So taking potentially 3 drugs together, that means for your physician, they might be filling out double or triple a lot of the forms that are needed to get these drugs supported. So providing financial assistance, getting the drug filled at a particular pharmacy. Other examples like Xtandi or enzalutamide can be taken with an injectable drug like Lupron, or drugs like Nubeqa taken with bone strengthening drugs like Xgeva. So it's very common in prostate cancer and the oncology space to be on multiple drugs, which is a lot more work, unfortunately, when it comes to getting access to these medications or getting them supported for the clinicians. The problem with patient support programs is they're often run by the manufacturer of those drugs. So they only support the drug they make. So there will be one program for abiraterone, one program for Zoladex, and they tend to not to coordinate together. But with our Haven program, your physician can just choose all 3 drugs and then get them all combined, all sent together. So it's basically a one-stop shop for your physician. They can just tick off all the medications they want, and we can put them all together from our pharmacy and send them to you. The other part that's often left out and can be time-consuming is getting supportive medications. So there can be a lot of extra drugs given with your cancer treatment, things to help with nausea and the side effects of your treatment. And often these patient support programs or your hospital pharmacy, they might not have these drugs available, and you have to get multiple deliveries of a drug. You might get one drug from one place, but then you have to go to another place or another pharmacy for your supportive medications. The one thing we try to focus on with Haven is getting everything combined together. We don't want to have patients go to 2 or 3 pharmacies, have multiple deliveries of their medication, which is just very time consuming for everybody, when they can just be all provided together. So that is what we try to focus on and make it a little bit easier when dealing with multiple medications. So this is what our Haven enrollment form looks like. It looks busy, but it's because it's trying to ask all the right questions. When the urologist or a medical oncologist or their treating nurse fills out the enrollment form for Haven, we ask all the questions that we need to support you. If they answer everything on here, or as much as possible, it means that we don't have to ask the treating team any more questions. We don't have to then call the nurse or the doctor and say, we also need to know these details. So it can look long, but it's really to make sure that we save on any of that back and forth communication. And you can see on the right on our second page, all the different medications that we're able to provide from our program. And you might be on some of these medications. They might look very familiar to you, but we're able to support also some drugs that are not supported by any other patient support program, drugs like bicalutamide or Casodex. Some of these medications are often considered too inexpensive to need any financial support, but that's not always the case. There are medications used for cancer that might be $100, but that can still be quite expensive for some people. So we make sure that we try to support every medication involved with prostate cancer, so that it's not just the high cost drugs, it's anything involved, so that we can support them all. So these are some of the different services that our team can provide. So as mentioned before, our drug access navigator is Stephanie. And what she does is when we receive one of the enrollments into our program, She will then see how this drug can be covered. How can it be paid for? Does this patient have a private drug plan through their employer? Is the drug covered by a public plan by the government? She determines if any of those are available. If it's going to be covered by one of those plans, is there any deductible or a copay that is required as well? How much is that deductible or copay? Is there someone who can pay for that too? So we try to make sure that at the end of the day, our patients don't pay anything if possible, or as little as possible for the medications that we support. Sometimes for cancer drugs, because of their cost, if you're getting them through a private insurance plan, they have these forms called prior authorization or special authorization. So what Stephanie can do is she will help fill out those forms with your prescriber, get them taken care of as fast as possible, send them off to the insurer, and she'll also keep calling the insurer to see when has it been approved, what's the status of that. So that's saving your treating team having to do any of those calls. Unfortunately, sometimes calling these insurance plans can be an hour or 2 hours waiting on hold, and that's not useful time for you. It's not useful time for your prescriber either. So we try to take on all of that very inconvenient time. Stephanie can do that, and we can try to get these drugs approved as fast as possible. If there are government programs that you're eligible for but have not applied for, we can help with applying for those. An example is the Trillium Drug Program in Ontario. If you have not applied for that, and it would be able to help minimize the cost of your drugs, that's something that Stephanie would be able to make sure that it's enrolled and as quick as possible, follow up, and try to get that approval done as fast as possible. For cases where a prior authorization has been submitted to a drug plan, like Manulife or Sun Life, a drug plan like those, if they do deny coverage, then we can also work to see how we can get that overturned. So we also make appeals when we do get a rejection. What was the reason for the rejection? Is it due to needing more evidence that this drug will work for this patient? Then we can look through the literature and we can see what we can find to submit back to the insurer and try to get that rejection overturned. Because ultimately, we want to make sure that anyone enrolled into the program is paying as little as possible for these medications. So we're not going to just apply once to an insurer and just leave it there. We'll keep trying to get it covered as best as possible through any sort of avenue that's out there. And Brenda will explain how she supports our patients.
Thanks, Alan. That's a good overview so far of the process that a particular case can go through. I will often help Stephanie, especially with the prior authorization before we work with your cancer team to get it submitted. I'm familiar with the funding criteria for most of the provinces, and also over time we've understood what the private plans will allow for coverage, and if we don't include this information or forget to include other information, it will delay coverage. So we're really a second helper to your team. Our job is to kind of be an extension of your cancer team. They're all very busy. We know that. We've worked in the hospital system. We understand. And we also know how difficult navigating reimbursement is. It should be simple. Your job as a patient should really just be, let's get this cancer under control. Let's stay healthy. Your job is not to worry, why is it not covered? When's it going to be covered? How much am I going to pay? Am I going to be able to afford it? You've got enough on your plate. Let us help and partner with you to get that done. One of the things that helps, because I am a pharmacist, is before we actually send the prescription to the Centrix pharmacy to get it delivered to you, we're already reviewing with you what home medications you're taking. Are there interactions that need to be addressed with your family physician, with your oncologist before you start? So it really does eliminate any delays in treatment before you get started. We will contact your community pharmacy to let them know you're on this treatment, so that if you do start any other new medications, we're going to be able to have them know what medicines you're on, so they can vet any new medications, how they will stand up to combinations with your cancer treatment. So you're going to get a few calls from our team, but it's really just one from Stephanie, one from me. We're connecting with your doctor to make sure that you're ready to start. We're getting the prescription in place. We're coordinating delivery to your home. And then you get a call from our pharmacy team when they're ready to set up delivery. And then I do contact you, calling you, emailing you, whatever preference you have, within a week, but more often based on what's happening on your end. If you're doing great, you're sailing through your treatment, you have the opportunity to contact us if things change. But definitely, I'm reaching out just to confirm that you've started, that you're taking the pills as we are intending you to take them. And then if you're having any concerns, I've taught many patients in my 6 years of oncology teaching at the cancer center I was at. So I know what the education materials mention, and I can help you get through some of the side effects and how to manage them. So, like I said, sometimes it's already done by your cancer team, and some programs across the country have a very good teaching program, but many of them are inundated with multiple patients who are on oral chemo. And so they flip their focus to training people on the IV form and allow the community pharmacy, or in our case, myself, to take up the education piece. And I would hazard a guess that I think my information, being an oncology trained pharmacist, is going to be a little bit more on top of the new literature. Community pharmacists, while they're fantastic and I do work well with all of my colleagues, they're not able to keep up with the oncology literature, which is what I'm focusing on. So if there's things that we can help you maneuver, that's great. So it's a little different. No other patient support programs right now do this. We've been very, very specific that we are knowing where the patient's experiences are and trying to come up with solutions. When I came on board with Centrix, one of the things that really struck me was you can go to any pharmacy sometimes and get your prescriptions, but will you get that individualized care that we can offer? Centrix has partnered in some provinces to arrange to have certain things like, is your blood work going to get done? Can we help set those blood work testings up for you? Can we arrange to have someone come to your house to do injections for you? In certain provinces, we can arrange to have that done by either a nurse or a pharmacist. So there's lots of ways that we can be, yeah, really a solution and an extra person in your court when it comes to your cancer journey. So Centrix is really, even though they've been in the market or not the market, been around since 2017, one of the co-founders, like they've always said, we know the healthcare, we've all come from hospital experience or community pharmacy experience, and we know there's challenges with healthcare in Canada. There are solutions, and we can come up with them. And so we've developed innovative programs like this one to be part of the solution to the challenges people have in maneuvering healthcare in Canada.
Thanks, Brenda. So when it really comes to why would you want to use Haven, what we try to focus on is providing that peace of mind. So just like Brenda said, you can turn to someone who understands what you're going through, who understands the drugs that you're being treated with, and can support you with their experience in a safe way. It's a little different than going to your local pharmacy who may have never seen these drugs before. They might not be able to provide the same level of understanding. There's also the convenience of having one program to deal with instead of multiple, especially if you're on multiple drugs. And also because this is the advanced prostate cancer group, the other problem with having one program per drug is when you switch from one drug to another, you have to start all over again with another program. You can end up having one program with one team you get used to, and then having to switch to another program with a new team to get used to. And it's not really ideal, but with Centrix and our Haven program, you can have one drug from support with Brenda, move to another drug, still get that same support with Brenda, and continue. So you don't have to uproot and go to all these new people when you start a new line of therapy. And of course, our primary goal with Stephanie is how can we make sure that you're not paying anything out of pocket for any of those cancer drugs. She'll turn over every stone, see what we can find, and see what we can make sure that if this is the minimum amount that you'd have to pay for that drug, especially if there's things like using a drug in the off-label setting, where it's rejected by the government programs or any private plans. Those especially can be challenging to get support for. And we try to make sure that we lower the cost or find a program that can do something to help. So how does all of this work if I want to use the Haven program? So sometimes physicians, as we know, can be very busy. They can be hard to reach. They're not always going to fill out the forms as quickly as maybe you want. But we do allow patients to just self-enroll with Haven. It's great when your prescriber or your nurse is filling in the form, because it does allow a lot of that information gathering to occur for us. We don't have to ask as many questions that way if we're being told everything on the enrollment form, but that's fine too. If that's not the way you get enrolled, you can just call us. So we do have patients who just say, I'm on this medication, I'm paying this much out of pocket every month. Is there anything you can do? So we have our phone number there. That's how you're able to reach Stephanie and Brenda. We can see if we can help with your particular situation. And again, when we do support patients, it's not done isolated. It's not done on its own. Everything that we support somebody with, we make sure to keep your medical oncologist or your urologist looped in the whole time. This was the drug reaction or drug-drug interaction that we found. This is the coverage that we sorted out for your patient. We've delivered the medication, right? So we want to make sure that it's a very smooth experience, not just for you, but your medical team is also aware of everything that we're doing to help you. Coming from hospital, it was kind of frustrating when we would enroll a patient into one of these patient support programs and we didn't know what they were saying to the patient. We didn't know what they were doing. Sometimes the patient would call me in the hospital and say, I'm already on the medication, but I was never even told that it was being sent out. We want to make sure that little hiccups like that don't occur with our program, which is why we make sure we work with your team, with maybe your hospital drug access navigator, and make sure that we're not doing anything inappropriate unless the primary treating team says, yes, go ahead and send the medication or stop the medication. We want to work as an extension, like Brenda said, just a helping hand for your doctors.
And that goes for refills too, because I think every month things might change. Maybe you've had a new drug start, maybe you've had a reason to stop the medication. So that's good information for your physician. It also helps them plan for your next visit. So every time we call and send you a refill, if there's anything that's different than expected, I'm getting a notification to communicate back to the cancer team. So you may have already called, like I had a patient, not a prostate patient, but same thing, went to the dentist, started an antibiotic. Now, what does he do? He called me because he knew that I might know. I'm a pharmacist. So I did instruct him to call the cancer center, which he had tried to do but couldn't get through. Sometimes that's difficult at some of the busier centers. So I was able to communicate with the team very, very quickly via email, and within a couple of hours, they were calling him to give him instruction on what to do. So like I said, it's an extension of the clinic. And, you know, my goal is to help patients on their cancer journey. This is a perfect job to do that. And I just love connecting with different prescribers and cancer centers across the country. So yeah.
Thanks, Brenda. We want to make sure everything is done safe. That's our primary goal above everything else. So if you do need to access our phone number or our enrollment form, it is available on the Drug Access Canada website. So if you go to drugaccess.ca/Haven, all of our contact details are there, and our enrollment form. So if you want to use us for a medication or something in the future, or to share with somebody else who you think might be able to benefit from support, that's the quickest and easiest way to get our details so that you can reach out to us. So we do get a lot of positive comments from people who use our program. This is not just a sales pitch. Brenda and I are not salespeople. We are very proud of the feedback that we get from doctors, from nurses, from patients, not only their patients, but from their family members too. So we do have a lot of interaction with the children of our patients and the caregivers. Sometimes it's them who are reaching out to us and doing a lot of the communication with Brenda and Stephanie. So we do get a lot of positive comments about all the support that we provide, being able to support patients really quickly too, so they're not waiting a really long time to get that help. We all know that cancer can be very urgent, and it shouldn't take days to reach somebody. It should be done quickly and by somebody who knows what's happening. So we try to make sure that we're living up to really high expectations. And a lot of the people who use our program have said really kind things about how happy they are. So this is just a small sample of some of the things we hear a lot. So just a quick recap. What we try to do with Haven is be a one-stop shop for all of the prostate cancer drugs that are out there. Whether you're on one drug, 2 drugs, 3 drugs, we want to make sure that we're making access to these drugs as fast as possible for your doctor and for you. If you're on combination therapy, we can get all of those combined together and sent from our pharmacy, just get one delivery. Our whole team comes from a hospital. We all understand cancer very well, highly experienced. And our pharmacy is going to be delivering from your own province. Some of the things we hear is, I'm on a medication, I live in Nova Scotia, my drug comes from Toronto. We don't have that. If you're in Nova Scotia, your drug comes from Nova Scotia. If you're in British Columbia, your drug comes from our Vancouver pharmacy. So it's always a local, quick delivery from the same area. And if you do want to take advantage of our services, you can self-enroll. The quickest way, as mentioned, is from our Drug Access Canada website. You can access our enrollment form there and our phone number. And besides our safety and our speed, we want to make sure that you're paying as little as possible for any of those cancer medications. So we try to make sure we help wherever we can to make sure those out-of-pocket costs are zero or at least as low as possible.
And to that point, like you said, if it's, the province that you live in, there's a central pharmacy for each province, and they'll deliver it right to your door at a convenient time. We'll sometimes use a courier service, but we do have our own fleet of drivers in some of our centers, so that's fantastic. There was something else I was going to say too. If you end up all calling tomorrow to ask me if you can enroll, the line will be busy. So please just leave a message. Again, it's just 2 of us on the line. So you can imagine if all participants tomorrow ring me out all the same time, we're going to have, the lines will be full, but there is a way to leave a voice message on our system. So please don't hesitate to do that. And I don't know, do you want to leave our email address, hey, Alan?
Yeah. Well, it's haven@centrex.com. I didn't have it written down, but
yeah. Haven is Haven. And that name was deliberately chosen to kind of be a support, a safe space to help you through your cancer journey. And then centrex.com. Yeah, it's in the chat. I think Myra's putting in the chat. So
that's great.
Yeah.
Thank you. Perfect. So thank you everyone for taking this time to hear us out. And if anyone has any questions, happy to chat.
Thank you so much, Alan and Brenda, for the presentation today.